So you have watched many cases like in foreign countries and India. So where do you find most infertility problems among the youth?
There are differences between different countries. So the infertility rate in Europe and in Spain, for example, is quite higher than India.
Okay.
Quite higher because of, again, of the lifestyle. Couples start thinking of becoming parents after 32, 33 years old.
Later.
And sometimes it is too late for some couples.
Yeah.
It could be too late. And it happens very frequently in Spain. So our infertility rate is quite high. It could be maybe 10% or so. In India, it's quite lower. Maybe it is around 5% or 4%, because in general, in all these populations, huge population that you have here, people have children also younger. That's the normal situation. But because of the numbers, you have 4% of infertility in 1.3 billion, I think right now it is the population here, the numbers are huge. Yeah. So the infertility population in India is huge compared with Spain or with Europe because of the numbers.
Yeah.
So we need to be ready for that also, because right now also lifestyle is changing so fast also in India. We are also acquiring here all these trends from Western countries about lifestyle. We want to travel, we want to know different places, we want to have good works, we want to have a house, a car, a dog. I mean, the whole thing before we think of becoming parents. So we now are also increasing our infertility rate in India. But it's a matter of numbers. You have a fewer proportion of infertile couples, but the population is huge here.
So according to you, what is the fertile age, the best fertile age for men and women, sir?
Again, we have to see the biology of our bodies, and the biology and lifestyle are not crossing, are not matching very well, because a women may be fertile once they are able to ovulate. Okay. It may happen at 11 years old. Okay. It's too early, obviously. But from 18 years old, 19, we are absolutely fertile. Okay. And biologically, it would be the best moment to do that, because the body is young, is strong. So anything from adolescence up to 35 years old. So from adolescence to 35 years old will be the best fertility moment. After 35 years old, for women, the fertility declines very fast. So if you ask me for the best time to become a mother, it would be from 20s to 30s. That would be the best moment. But obviously, lifestyle is different. Yeah. Nobody right now nobody. Very few people think of becoming parents before 25 years old right now, because you are making studies, you are also making master degrees, you want to have a work. So, lifestyle has changed, and we have to adjust also to that, because society has changed.
So, what is total quality management system at 49, sir?
That's a big question again, because when we say total, it means total. Yeah. So we are talking about everything almost. So quality management has to do with everything. It has to do with quality itself, which has to do with quality control and quality assurance. So the checks we do for all our equipment, for all our procedures, the results that we have, the SOPs that we also have about all the procedures in the laboratory. So quality is a very broad concept, very big concept. And how we manage that quality has to do again with teamwork, has to do with the culture in the company, has to do with training also in our SOPs. And finally, this total means that we are having a very holistic approach, because we use this for providers, the technology we use, the media we use in the laboratories, for patients, again, knowing what they expect from us about results, about the transparency, about the information, but also with employees. So it's really a very holistic way of managing quality in all different aspects. We need to have quality in results, we need to have quality in our SOPs, we need to have quality also in the way we train people in our system. So really it's about a quality culture. We need to have a quality culture in our system, in which everyone is proactive and trying to improve every day.